Hi, folks. Thanks so much for joining us for today's Safety and Health Magazine webcast sponsored by Shoebox. We're going to let our audience settle in for just a minute and we will start the presentation shortly. Thank you. Once again, thanks, folks, for being with us for our Safety and Health Magazine webcast. We'll start the presentation shortly. Thank you very much. Hello, everyone, and welcome to today's Safety and Health Magazine webcast, Hearing Conservation. Hear from the experts in tablet based hearing testing, sponsored by Shoebox. My name is Barry Botino. I'm an associate editor at Safety and Health and a co host of the On the Safe Side podcast. I'll be the moderator for today's event. Before we get started, I want to share that the views of today's speaker and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health magazine. Any mention of a commercial enterprise, product, or publication does not mean the council or the magazine endorses those items. At the conclusion of today's event, we'll conduct a Q&A with our speaker. If you have a question at any time during the presentation, just click that Q&A button located at the bottom of your screen, type in your question, and tap the send button. After this presentation, you'll also be asked to complete a brief evaluation survey, but I'll tell you more about that a little bit later. This webcast will be archived. If you want to view this presentation or any of our past webcasts, please go to safetyandhealthmagazine.com/events. Now let's introduce our speaker. Joining us today is Renee Lefrancois. Renee is the Director of Audiology at Shoebox and has practiced in the field since 1999. She spent 15 years working with cochlear implants before taking on her current role, which involves diagnostics and hearing conservation. She leads the internal clinical team at Shoebox, as well as the external audiology network, which provides state licensed review and supervision services in the US and Canada. Renee resides in Ottawa, Ontario, and enjoys all things outdoors in and around the capital city of Canada. With that, Renee, welcome and please take it away.
Thank you so much, Barry, for that lovely introduction. And I'm eager to spend the next hour together with all of you discussing our experience and also our predictions in terms of innovations coming up in hearing conservation testing and recommendations. We have a few questions that we'd like to start with. We have three questions here. The first one, are you familiar with Shoebox? So that doesn't necessarily mean that you've used a Shoebox product, more just, have you heard of us before? Or is this the first time that you're learning about our audiometry systems? The second question is, do you currently manage, whether it's directly or indirectly, a hearing conservation program at your place of employment? And the third is if your organization does have a hearing conservation program, how are they conducting their testing? Are they sending employees to offsite clinics? Another option is bringing service providers on site, which typically means trucks that will come in with sound booths. And the third option is managing your own testing program in-house with something like Shoebox. So we'll just give about 30 more seconds for everyone on the call to be able to answer those questions, and it'll certainly help me concentrate on specific areas throughout the presentation. I'd be remiss just if we, as we take this pause in the slide presentation to allow people to answer the poll, to say that we are certainly thinking about all of our colleagues, friends, and family in the Florida area, and we're really hoping that the cleanup and progression forward is going to happen without any ado. So, for any of you in that area or with friends and family in that area, our thoughts are with you. All right, so here we have some poll results. So are you familiar with Shoebox? We have 17% of respondents saying yes. This is so exciting. We have 83 respondents that have said no. So I'm so glad you're here today. Thank you for giving us this time. And I can guarantee that at the end of this presentation, you will be able to have 5 key takeaways in terms of what is Shoebox and how it might be able to help your organization in terms of hearing conservation efforts. The second question is, do you currently manage directly or indirectly a hearing conservation program? So here we have 67% respondents yes. So that's a strong majority there. And also question number 3, how is the organization conducting testing? So we have about 50% sending employees to offsite clinics. We have about 30% bringing the service providers on site, and we have a 23% that are actually managing their program in-house. So I'd like to thank everybody for responding to those poll questions. I'll certainly be coming back to those throughout the presentation. So what is Shoebox? We're just celebrating 10 years in the business. We were a startup innovation company that began in about 2010, but really after our validation studies and such, we were available on the market in 2014. And at that time, we were the first iPad-based hearing test. And it really helped empower certain organizations to take more control and have more facility in scheduling for their hearing conservation program needs. We've been the lucky recipients of several awards, and we support programs of all sizes, so small, medium, and large customers. I know for audiological review, currently we support 140 different organizations, but in terms of the number of organizations that have used Shoebox for hearing conservation, that number's above 1,000 different organizations. This is what this system looks like. Some of you might have been asking yourselves, why is it called Shoebox? Well, this is why. At the time, we were wanting something that was very easily transportable and easy to store. And so that case that you see on the right side is where all the equipment resides. So you'll have the stand, the iPad, the noise attenuating headphones, and the microphone used for noise monitoring. And all of that is, can be very closely put away in that very easy case. It doesn't take up a lot of real estate in terms of testing and can be easily moved from one room to the next. Now, the power behind this system, which is not as clearly depicted in this image, but really is the data management and review capabilities. And so with an internet connection, now note that this system is able to be used online or offline in its full functionality. But once you do connect online, if you have been offline, all of that data goes up to our HIPAA compliant individualized cloud for your organization. And you're able to manage your data and the review needs and follow-up actions all in that portal. And every system comes with its own individualized portal that only your organization has access to. We provide training not only to the hearing conservation program administrators, but also to the test administrators. And we've been lucky to be a trusted partner for many organizations and some large organizations throughout our 10 years in this industry. Here is an overview of the various topics that we're going to be covering today. And so a lot of this information is unique to shoebox, but it's also generalizable for any other audiometer or hearing conservation program that you are in. So for those of you who are currently managing a program and perhaps using other technology, I'm confident that you'll have takeaways from today's presentation that could help, or at least have some thinking points in terms of what would be the best next steps for your organization's hearing conservation program. We will end the presentation with some tips for OSHA compliance and data management, and we'll just jump right into some statistics. So I know that many of you on the call are already fully aware of the impact of noise exposure on our employees' hearing. And what you might not know is that it's the most common work-related illness in the US, and this is according to the CDC. There are 22 million workers that are exposed to hazardous noise. On top of that, there's 11 million workers that are exposed to noise and ototoxic agents. So, toluene, benzene, even tobacco smoke, those are agents that can also be toxic to the ear. And when they're presented in combination, they actually have not an additive effect, but a synergistic effect. So more and more research is looking at the combination of both a solvent exposure and noise exposure when they occur concurrently. So 12% overall of workers experience hearing difficulty, and 24% of those individuals have a tie to occupational exposure. We know hearing loss is a concern for communication, but we're taking it one step further in terms of what does that look like for a particular individual? Well, people constantly asking for repetition, or an individual that is hearing things incorrectly, and that's often what happens with hearing loss. It's not that the individual doesn't hear something, it's that they mishear it, because hearing loss is generally sloping, and so the low frequencies are typically pretty good. It's the high frequencies, those that bring clarity to speech, where the hearing loss and hearing loss due to noise is located. And so this is very unfortunately negatively impactful on people's relationships. And so that could be relationships with family, but also relationships with colleagues. And we know how important that is, and corporate culture in the workplace. Workplace safety, so being able to hear commands or directions accurately, as well as hearing alarms or even hearing disruptions that are going on that might help warn somebody that an event is going to happen. And so we really want to make sure that all workers have their hearing in terms of knowing their surroundings as optimized as possible. And then, of course, there have been health complications linked to untreated hearing loss. These occur later on in life, but the WHO, when I talk about later on in life, cognitive decline, dementia, Alzheimer's, but the World Health Organization has actually stated that untreated hearing loss is the number one modifiable factor to help prevent these health complications long term. So, and we say it's the number one midlife preventative factor. So, what could potentially happen 30, 40 years from now is what's happening today in terms of being able to maintain those hearing levels and or to treat hearing loss. And I think that's a really important point. There's often a misconception in hearing conservation that we are trying to not find any changes in hearing. And that's actually the opposite of the purpose of a hearing conservation testing program. The testing program is there to identify individuals who are more susceptible to workplace noise. And so we know that there's standards that we follow from OSHA, perhaps from NIOSH, but those standards are an average, which means that we have a pretty significant portion of the working population that could be more susceptible to levels of noise lower than the actionable level as recommended by OSHA. And so when you're reviewing audiologists or physicians identify a case of hearing loss in which the workplace cannot be eliminated as a causative factor, that's a good thing. That means that the hearing testing is working and we're able to identify those individuals. The typical, of course, it depends on the type of noise and the intensity of the noise, but typically OSHA has stated that the percentage of recordable shifts measured should range between 0.5 and 3.3%, depending on the industry. So anyone who comes to us and says, "Oh, we have 1,000 employees and we haven't had a recordable in 5 years," and all those employees meet the action criteria of 8 hours, 85 dB time weighted average exposure, that's a red flag. The red flag of having no recordables, because with 1,000 people, we would expect, a significant number, not a high number, but certainly not zero. And so I would recommend that some conversations be had along that, because I think that historically, there's been some thinking that if everybody follows the OSHA recommended guidelines, that there won't be any recordable shifts, but that's simply not the case. So we just talked about the action level of equal or above to 85 dB over an 8-hour time weighted average. Of course, we know that there are various arms to a hearing conservation program, including some dosimetry, noise surveys, informing employees if they work in an area above the action level, provision of hearing protection, not just one type or two brands, but actually two different types. So here in this photo, you see a type of hearing protection that's known as muffs. Some people might also call them pelters, but those are ones that are worn over the ear. They can also be worn in conjunction with in-the-ear protection. In-the-ear protection, so foam tips or phalanges are typically the hearing protection of choice used. So a company often will also have their internal hearing conservation best practices program available to their health and safety team, and testing at time of hire and annually. So talking about those three options that we addressed in one of our polls at the beginning of the presentation. So here we have option one is clinics. And this is certainly what's been used standard over the past several decades. And this is often what is used in clinical audiology. So it does have a high per cost employee investment, simply because not only does it cost money to actually send people to these clinics, the transportation, but also the productivity, loss of productivity for the time of testing. One thing I wanted to draw your attention to is that occupational health clinics are certainly a great option for many organizations. And the fact that they can do multiple types of testing, spirometry, drug testing at the same location is very helpful. Those locations, I've not yet found one that has an audiologist on staff. And so whoever is doing the testing is using an automated platform, very similar to what is already available in Shoebox. There could be some individuals who are KAOC certified as a hearing tester that could be doing manual testing, but the testing that they are trained on is quite basic. And so I want to just make that differentiation between sending someone to a hearing clinic, so with an audiologist or a hearing instrument specialist, in which they can do a full and adaptable test on that individual, versus an occupational health clinic that basically is doing an automated test, similar to what you can do in-house. The second option is service providers. So service providers typically have been using mobile units or trucks with single-walled sound booths inside. So double-walled sound booths are really the standard in clinical audiology, but they're very expensive and don't fit well in a mobile unit such as this, typically. So that's something to keep in mind, is that yes, they might be testing in booths, but if they're not respecting the noise levels that are needed for hearing testing, which we see all the time, then being in a booth is no better than being in a quiet room. Something that has been interesting, though, because of the environmental footprint of the trucks and the difficulty scheduling and the amount of distance that needs to be traveled in order to get the truck to the right place, is we now have individuals who are service providers who either drive or fly to different locations, but instead of using a truck, they use shoebox systems. So an individual we have can travel with up to 4 to 6 systems and come to your workplace to test your employees for you. So that is, it's nice to see that the service providers now have options. Of course, the main use case that we're talking about today is tablet-based hearing testing that can be done at your place of employment in a quiet room with a door. Sound booth is not required. We do walk and coach you through selecting an environment where testing would be best for your location. And you're able to schedule hearing tests based on your schedule. So we have certain manufacturing plants that run 24/7, and they're able to not have to pay premiums to have hearing testing done at 3 o'clock in the morning because they're able to use their own staff. Whereas if you were using a service provider, there would likely be an increase in fees for testing at that time. So because the systems are on site with you, you're able to use them for in-house testing, baseline testing, pre-employment audiograms, annuals, but also retests. We hear from a lot of organizations that the retests are quite labor intensive to schedule and a bit of a pain. And so here with retests, you're able to do them, we recommend doing retests about 7 to 10 days after the initial test so that any blockage that has been impacting the hearing values has a chance to naturally rectify prior to a retest. So really, you have all that scheduling power in under your control when you bring your program in-house. So what is tablet-based testing? Well, we have clinically validated software on an iPad, and the validation that's been done on our testing algorithm is truly incredible. We have many independent validation studies that look at the testing algorithm with excellent sensitivity and specificity values. For those of you who aren't familiar with biostatistics, basically, when a test is sensitive, it does not provide false negatives. And if a test is specific, it does not provide false positives. And so you're really looking for that, and you're looking for values above 90%. And thankfully, Shoebox is best in class there. We're looking at, in some studies, we had 100% sensitivity and 100% specificity. So you can rest assured, because it was developed by audiologists, that this is a gold standard testing algorithm. It's convenient and accessible. More and more people are familiar with iPads, and especially in health and safety testing and medical testing. We can test in quiet rooms, so no sound booth is required. If you happen to have sound booths on site, not a problem. We'll be happy to integrate those into your testing protocols, but typically most of our customers do test in quiet rooms. For work relatedness, we incorporate a questionnaire prior to the test, and this questionnaire is now on its third iteration, and we're very confident that we're asking the questions that need to be posed without asking questions that go against some current privacy regulation. It's self-directed, so an employee can test themselves. If ever you have employees who are struggling because they're anxious about getting hearing tested, or they're not familiar with iPads, or maybe their English isn't very strong. Now, note that this program is available in several languages, and we can actually, just by changing the language of the iPad, you're able to change the language of Shoebox. But we even have individuals who might struggle with literacy. And so that is not a problem at all. We can use someone on the health and safety team to help administer the test with the same highly valid results. So in terms of bringing your program in-house, well, you can rest assured that you would have no need for off-site testing unless there is a very complex hearing case, such as someone with a cochlear implant or someone who's missing an outer ear. And but Everything from pre-employment audiograms to retests can be done on site. You can choose your scheduling, and we have a professional services team that can help you with that. So, whether you want to test in batches, if you want to share systems between locations, we have a lot of larger organizations who do that, or a rolling schedule. Some people choose dates of birth or dates of hire to arrange for their hearing testing. So schedule optimization, you're able to, for example, if you're on a large campus and you're needing to test a specific team's hearing, you can bring that system to that location as long as the noise levels are sufficient or sufficiently low. And so we've found that employers have said that the opposite of reduced productivity is that the whole thing can be done typically in 30 minutes maximum, including the employee walking to and from the testing area. We discussed data management in our HIPAA compliant web portal. Audits, we've actually had a number of OSHA inspectors actually recommend our system when organizations are struggling with their hearing conservation program. Having all of your data and your historical data in one place is really helpful, and it's what the auditors are looking for. Now, this is a bold statement when we say with shoebox more clinically valid results. And I'd like to expand on that a little bit because that is actually my statement. Um, in reviewing for the past 10 years, historical results that were done typically in mobile units that were parked in parking lots for testing, is I assume that noise monitoring would have been done because it does need to be done every time a test environment is moved. I believe that they were done at a time that didn't best reflect the peak noise levels that are there in parking lots or in highways when you're testing throughout the day. So what we're seeing is a deviation, an artificial deviation in low frequency hearing levels, so 500 and 1000 hertz. So we're seeing a deviation of 15 to 20 dB on those levels simply because of the noise that these mobile units are exposed to at peak times. So with Shoebox, we're not only measuring the beginning of the test day, you have the option of testing before every test. And there's also ongoing noise monitoring throughout the test to ensure that we are not exceeding the levels needed for a clinically valid hearing test results. I'll give a moment for those of you to read some of these testimonials. So talking about, central location and job performance, but one of our very first landmark customers was Southwest Airlines, and they have a hearing conservation program of about 20,000 employees. And they've decided to go with the date of birth cycle. And they really we learned along with them in terms of some tips and tricks to make this happen, but they've skyrocketed their overall testing compliance percentage up to, I believe they're at 98 or 99% for 2023. And so I'm eager to see what 2024 is showing, but we certainly partnered with them with that goal in mind to try and get every employee tested that qualified for a hearing test. Now, we've learned that with hearing conservation, employee buy-in is essential. It's essential for them to understand why the annual hearing tests are important. And also, when they are more involved in the hearing test, they tend to be more committed to wearing their hearing protection and to complying with the recommendations following testing. We also have had quite a number of conversations with OSHA and OSHA inspectors, and so you can trust us to be a partner should that be something that your organization undergoes in terms of an inspection of your hearing conservation program. But we also have a number of larger organizations who have internal audits, and we also provide support for those. So the self-directed testing approach has been shown to reduce stress on behalf of the testee improves engagement, and we're seeing a higher level of accuracy, empowering those employees. So the first testimonials that I presented were on the base of employers. Here now we'd like to focus on some employees and what they had to say. Now, I mentioned early on that for those of you who are using other technology, these are great tips to find out in terms of the product that you're using and what the offerings are. So the OSHA noise standard does really delimit, especially in terms of noise monitoring, but also in terms of what type of audiometer is acceptable to use for hearing conservation testing. And in their standard, they actually refer back to ANSI. Well, this bodes very well for Shoebox because our audiometer was built from the ground up based on the ANSI standard. So you will find that we meet and exceed all of the OSHA requirements for equipment and for noise monitoring. As I mentioned at the beginning of the presentation, we have offline testing capabilities. And we follow some OSHA recommended practices such as bioverification, which is having someone test their own hearing at the beginning of the testing day. Usually it's the test administrator. And we've dropped that down from needing about 8 minutes to now most people do it in a minute and a half. So significant time savings there. I can't stress this enough, but continuous noise monitoring is really the key. If you do it well, this is what enables you to perform clinically valid hearing testing outside of a booth. It is impossible for the human ear to monitor those noise levels without equipment. And the reason being is actually brain plasticity comes into play here, but certainly the low frequency, which is where noise is most problematic, but 500 hertz and 1,000, is that we're accustomed to blocking that noise out. If we had a fan to our right side and someone we're trying to listen to on our left side, our brain actually focuses, has almost like a directional microphone focus on the person that we want to hear. But the issue being is that it also reduces focus in terms of the level of noise in the background. So if we are so used to our system doing that, then we are conditioning ourselves to not pay attention to background noise, which is a good thing for communication, but it's not a good thing for hearing testing. And so, I would welcome a conversation with anybody who thinks that they can do it with their natural hearing, but really a microphone and a sound level meter, which is incorporated into the shoebox audiometer, is what's needed to be compliant there. We've talked about data management. We know that many of you on the call have transferred over from paper documents to electronic documents, and that was likely labor intensive for historical hearing records. That said, you only need to do that one time. Once it's in Shoebox or any other electronic machine readable format, that data can then be transferred very easily, either transferred to a system that, perhaps a more general health and safety web portal, or moving providers, for example, or in the case of workers' compensation or specific case downloads. You have all that control at your fingertips with our web portal. And we've heard nothing but really positive things, not only from our hearing conservation program managers, but also our reviewers who are able to seamlessly add in recommendations and notes on specific employee cases that are protected and seen only by the administrators of the hearing conservation program. So we've got you taken care of from a privacy standpoint, from an ease of use standpoint, and from a forward-thinking standpoint, making sure that from this point forward, all of your data will be easily housed in one file or one product. So our web portal is accessible on any computer, As I mentioned, it's HIPAA, but also ISO 27001 certified. That is a big deal. If you're currently using, a technology for hearing testing, I would ask. I would say, are you ISO 27001 certified? Because we know that privacy and technology requirements are changing at a lightning speed pace. And so having these certifications is really extra confidence that we, as a technology provider, are also keeping up to date with those changes. We have an automatic sync as soon as you're connected to the internet, whether that be through Wi-Fi or through cellular service. We have shift reporting. So we have a nice dashboard that we have another slide that I'll show you. But in terms of how many people might be late for testing, how many people require follow-up, and it's all really nicely visible in your homepage dashboard. You're able to download comprehensive and customizable reports for your organizational needs. You can manage data across multiple devices. I think our largest project has 200 iPads that all feed into a similar portal. And another question you might have is, well, if you have that many systems, does that mean more than 200 individuals have access to all the data? Absolutely not. We actually have 5 different levels of accessibility on the web portal so that private health information is not visible to individuals on the team unless it needs to be. And you have full control with those permissions. So here is our new dashboard. You'll see here some titles including overdue for testing, waiting for retest, waiting to be actioned for follow-up. This was 100% stemming from customer feedback, and we love it. It's really been a game changer, a time saver, and it's a nice way to, for those who are only logging in once a week, for example, to be able to see exactly where everything's at and what needs to be done to achieve full compliance. We also have a separate section called Shoebox Learning, which is has some videos and a knowledge base in terms of if you have, for example, someone who's new to your organization and needs to catch up to the other test administrators or hearing conservation program managers. There is a lot of good information that is free to access on the portal. So how the process works is you have the questionnaire that you fill out at the beginning, the test, the analysis at the end of the test, and whether or not a retest is recommended. Now, once that is all uploaded to the portal, then you can have the audiologist or physician who's associated with your program do the review, confirm or reclassify the shift, or provide a recommendation for referral. So for different sizes of organizations, we actually have different suggested models. So if you're a small organization under 150 employees, we recommend that you use the shoebox audiometer, and you might have a local audiologist or physician that you've been working with for health and safety. And so that typically works well, and we can branch that in terms of web portal accessibility. If you're larger than 150 employees, often multiple audiometers are recommended, as well as our audiological services. So at the beginning of the presentation, Barry mentioned that I oversee the external network of audiologists. So in the US, in order for an audiologist or physician to review a hearing test and make recommendations, they need to be licensed in that state. So most physicians and audiologists are only licensed in the state in which they practice, but this is changing, and we have more telemedicine and teleaudiology regulation changes. And so with larger organizations that come to Shoebox, we actually have audiologists that are licensed in every state. So we're able to seamlessly combine that behind the scenes so that your review is happening all together with Shoebox, and that review is done within a 7-day period. Now, I mentioned earlier that you can also have a service provider option, or if you are a service provider, then we would recommend the audiometers and the fleet management. So we have a multiple device management option with our systems. And we've been working quite well with some service providers flying all over the country with shoeboxes. So that's been really exciting to watch. So why is an audiologist or a physician needed? Well, we know that that's what it says in the OSHA noise standard. So you do get an expert interpretation of the audiogram, which again, in 95% of cases is not necessarily needed, especially if there's been no change in hearing. But we've identified some pretty serious health conditions. So OSHA tells us that if an audiologist or physician is looking at the test results, they also need to identify any medical red flags that they notice. And so, what can that mean? That can mean a sudden change in hearing, that can mean a blockage in an ear. It can also mean some issues behind the ear, such as auditory tumors. So we're able to identify those just based on a basic audiogram and really change that employee's life going forward by making a recommendation. So this adds an essential human element and clinical expertise. And I also am proud to say that I'm not sure if other audiological providers do this, but we found over time that in talking with people who are showing shifts or specific health issues with their ear or hearing health, is that we have one-on-one consultations with them. Ideally, they'd be in person, but of course, we can't be everywhere at the same time. But we found that in large part post-COVID, people are amenable to having a web meeting, and we've been able to have no less than, I would say, 40 of those in the past 2 years to really have that personalized attention with employees who are struggling or who might be susceptible to some differences with their hearing that are combined with health conditions or medications, in which a questionnaire is not sufficient to identify those, because that's private information. So rest assured that when you are with the Shoebox Audiology Review Team, that is part of our service. And we normally work together with our organizations to identify employees who would benefit from a one-on-one consultation. So automated systems, they're quite good for measuring if there's a mathematical shift in hearing or a mathematical STS. But in our analyses, our audiological review actually reclassifies over 75% of STSs as non-work related. So if you're only using an automated system, you're missing out on that reclassification. And that's a negative aspect for both the employer and the employee. And not actually, let me add a third one, and to OSHA, because OSHA wants their data to represent hearing changes due to occupational exposure. If a hearing change has not been appropriately classified, then those values are polluting the overall database. And so, and we also want, employees who are having a shift that is linked to occupational exposure to have that one-on-one consultation with their health and safety team to find some hearing conservation methods such as earplugs or pelters that can help reverse, or sorry, I don't want to mean reverse, but stop the progression of their hearing loss. And that's really one of the main goals of the hearing conservation testing program. So this is an image of what the audiogram looks like in the gray area. The gray line is the baseline hearing test, and the red and blue represent the current hearing test or this year's hearing test. And we also have an analysis section. Now, again, this is just the mathematical analysis. So it shows that there's a recordable shift in both ears prior to audiological review. But as I mentioned, 75% of cases that will be reclassified. So in terms of audiological or physician reviews, you want to choose qualified providers, providers who are familiar with the OSHA noise standard. Any licensed audiologist can legally perform this service, but you'll find that there are additional certifications such as CAOC, professional supervision, that becomes really helpful when you're immersed in occupational hearing conservation. So that individual should be able to ask questions about your hearing conservation program protocols and have a place for you to seek support when questions do arise. In terms of tips for OSHA compliance, we know that OSHA states that baseline testing should be done within 6 months if there is a new hire in your organization. Most organizations do test a lot earlier than that, though, and especially if you have the systems in-house, most organizations do it within a 1 month of hire. So being able to monitor hearing annually, we can work with KAOC certified testers or not, depending on the state that you're in. The calibration is taken care of because we're a subscription model. The calibration is something you don't need to worry about because we notify you when your calibration is coming due, and we actually send proactively a newly calibrated headset so that there's no testing downtime. And once you receive the new headset and download the calibration, then you return the existing headset in the packing materials that we have provided for you. So it's a truly seamless turnover from one year to the next. So not only are we maintaining hearing testing results, but we are also, it's very transparent in terms of noise monitoring results, which I know our clinicians really like, but also our OSHA inspectors and auditors, because they know that for that particular test, they are 100% sure that those were the noise values that were obtained during that test. In contrast to the example that I mentioned earlier on, when the OSHA standard says you need to test once per testing day, but if the noise is not stable throughout the test, throughout the day, then that noise monitoring that was done, perhaps at 6 a.m. in the morning is really not applicable to tests that are done at 11 a.m., for example. So OSHA does recommend keeping the records for the employee's employment. And they're obviously having all this in the data management portal, but password protected is really helpful. So we recommend, regular reviewing of your program. For example, OSHA suggested a change to their age correction factors that happened 2 years ago. So using the new age correction factors is key for moving forward. That's something that Shoebox has invested a lot of resources into to make sure that transition over is as seamless as possible. And we wanted to share our expertise with you. So we recommend, providing a review of your hearing conservation program if that's something that you choose to use in terms of our services. But I would have to say most of our large enterprise clients do send us their hearing conservation program documents in terms of the clinical team for clinical review and a stamp of approval. We also provide extensive onboarding services. And we mentioned, this licensed audiologists in every state. So that is something that is taken care of behind the scenes if you choose audiological services together with your audiometers. So all in all, I really hope that the resonating message of today's presentation is that we are very much open to being your partner for hearing conservation, and we provide equipment, services, and audiological review for compliance so that you can come to us for all of your hearing conservation testing needs. Thanks very much. I'll pass it over to Barry and we'll open it up for some questions.
Great. Well, thank you so much, Renee, for sharing your knowledge and your insights with us today. Before we start the Q&A, I want to let everyone know about the evaluation survey that we're asking you to complete today. The survey will open in a different screen after this webinar, and your input is really important to us because it does help us to improve our future webcasts. We'll try to get to as many questions as possible today, but any unanswered questions will be forwarded along to our speaker after the event. And as a reminder, click that Q&A button at the bottom of your screen and feel free to submit your questions. And Renee, what we want to start with today is a question from our audience. And our questioner asks, we've been using a hearing van for the last 10 years. How do we transfer employees' baselines into your system?
Excellent question. Historical data is so important in terms of adequate classification of changes in hearing. And the more data that your clinician has access to, the more accurate of a classification they can make, because noise-induced hearing loss due to workplace exposure happens gradually and happens the both ears have a relationship to each other. So the more we can see that relationship and that progression, the more certain we can be of whether it is noise or conversely not noise. So all you need to do is ask for a machine readable CSV format of the data. We have a data import team that can help in terms of guidance. We have a template that you can use. So that is one option. But another option might be when you received your reports from the service provider, they likely provided a report to you. You potentially may have imported that into another system for health and safety record keeping. It's possible that you can download directly from that system in terms of that machine readable format. So, that is something we can partner with you on, and certainly a service that we offer all of our new customers.
Great, thank you for that. The next question we have today, Renee, is could you discuss a little bit about how long a test takes and what that process is like?
I'd be happy to. We normally say that each frequency takes about 30 to 45 seconds per ear. So we have 14 frequencies, 7 on each side. And usually it takes about between 6 and 8 minutes for someone to complete. If someone is not familiar with the iPad, with an iPad in general or a tablet in general, sometimes it can take a little bit longer, but that's why we have what's known as assisted mode, which is the test administrator driving the test as opposed to the employee doing it themselves. And that's been shown to be 30 to 40% faster. Now, those timelines are for a first time test. So for individuals who are, let's say it's a large organization and then they're on their third year of shoebox testing, you can cut that testing time down to 5 to 7 minutes because people are familiar with the test. Thank you for the question.
Excellent. Excellent. Our next question from the audience is does your system have the ability to test sound levels and measure time weighted average when sound surveys are needed?
Oh, great question. And the answer is no, but I say that in a positive spin. And that's because Shoebox is a specialist in diagnostics, which means hearing testing. And in terms of noise surveys and dosimetry, it's actually quite different in terms of noise exposure because that's measured in dBSPL or dBA. And typically, it's either done with a dosimeter that needs to be worn, so that would be really difficult with an iPad, but also just in terms of the metrics needed. So we do have some recommendations if you do need dosimetry in sound surveys. We often, look on a territory by territory basis to make those recommendations. So the answer is Shoebox doesn't do the measurements themselves, but we can certainly put you in touch with someone who can.
Great. Thank you for that. Our next question from the audience is what type of operator training is needed to certify the in house tester?
Ah, so CAOC, the Council for Accreditation in Occupational Hearing Conservation, provides an OHC, an occupational hearing conservationist, 2.5 day course. We feel that that course is useful very much for anyone who's never tested hearing before. It's also mandatory in specific states. So Oregon, Washington, to a certain extent, California. So the other states, the ones that I didn't mention, there is no mandatory need for certification, but in all states, the hearing testers need to be responsible to an audiologist or a physician. And so you really need to make sure that you have that professional supervision role filled. And we work together with organizations in terms of their training needs. So, for example, perhaps they will send the initial testing team when they first onboard Shoebox for KAOC certification, but then the subsequent individuals that come after that are trained by the trainer. So really the choice is up to you. A KAOC certification course is usually around $600, $650, and there's probably 50 at minimum offered per month across the US. And since COVID, it's been, they've modified it to be online quite a bit, so a lot more accessible than it has been in the past. But the short answer to your question is that other than in Washington, Oregon, and California, certification is not mandatory.
Renee, that's a great point you brought up about changes in training with COVID, and we've written about that in Safety Health a lot, Safety and Health magazine a lot. What has changed in audiology since COVID, do you feel? And are there anything that, how have things advanced?
Oh, they've catapulted in front. It was a very sad situation that made this happen, but we are certainly reaping the benefits, and the patients and the employees are reaping the benefits because the regulations have changed in terms of teleaudiology and telehealth. So even mentioning these one-on-one consultations with employees, I mean, I can't even tell you the impact that it's had on the employees, but also on myself as a clinician. There are certain circumstances that have been really helpful to have been brought up in terms of that synergy between general health, medications, and hearing that just are not attainable in a regular, distance method with a questionnaire and with testing. So being able to elevate that, and I think if we did that before COVID, some of the employees might have been like, am I in trouble? Why am I being called in for this? But instead, they seem to be welcoming and really seem to be more engaged with the hearing conservation program because they view services like this as a value add.
Excellent. Um, our next question from the audience: what are your IT security certifications?
Oh, excellent question. We actually have a 4-page security document on our website. So Jennifer, we will send that to you, and you will be able to see those. I am not on the privacy team, but rest assured that it is a strength. So I look forward to sending you that document.
Excellent. Thank you for that. And thanks, Jennifer, for the question. The next question we have for you, Renee, is what type of training do you provide to customers, and how does that training differ from the CAOHC courses?
Right. So the KOC courses. So one of the things that the KOC course does really well is the practical aspect. They also train in manual testing. So Shoebox does have the option for manual testing, but the vast majority of our customers use our automated testing. And so, we are big fans of KOC training, but again, it's probably going above and beyond what's needed to effectively use Shoebox. So we provide about an hour and a half training total for the test administrators, and we cover things like, how do you test someone with tinnitus? What situations do you want to not test? So in the case of congestion and waiting for that. So we provide recordings of those trainings so that and they are customized to your organization. We provide workflows and professional supervision that is fully customized, and therefore is very easy to be able to share that in your organization so that the train the trainer model is sustainable over time.
Great, thank you, Renee. And just so folks know, we obviously on the screen here see the email address and the website for Shoebox. So please feel free to do that. They'd love to hear from you. And also, Renee, you mentioned the OSHA standard, and just wanted to point out that 1910.95G3 is the OSHA standard for our audience who'd like to check that out. One more question we have for you, Renee, today is: would you recommend asking the clinic that we use about what certifications and knowledge that their testers have?
Yes, I think that would be very important, but also their equipment. Because as I mentioned, if it's, manual testing, when it's very clear cut, can be pretty easy, but when there's differences between the ears or fluctuating hearing or tinnitus, that's where additional validation of a very robust testing protocol is needed. So I would encourage that. And Barry, I see another question here that I'd really like to answer. I'd like to close on a high.
Certainly.
And that was, have you worked with the federal government? Absolutely. More than I can say on this call, with probably without giving too much away, but let's say with the highest level of security clearance. But one thing I know that I'm allowed to divulge is that the federal State Department has purchased audiometers from us. Some of you may have heard of Havana syndrome, where that noise was used, undetectable noise was somewhat used as a bioweapon. And so now what that State Department has done is has equipped embassies around the world with our audiometers so that it should something happen to their staff while off-site and overseas, that they're able to have a quick hearing test to determine whether or not they've been impacted. So that's for me really quite a mind-boggling use case, and we're very proud to be part of that.
Great. Thank you, Renee. And thank you to James for that question. Folks, unfortunately, we have run out of time today. We thank you all so much for attending, and we appreciate you taking just a minute to share some feedback via our survey. A big thank you goes out today to our terrific presenter, Renee Lefrancois, and of course, everyone from our sponsor at Shoebox. This ends today's Safety and Health Magazine webcast. Take care, everyone, and have a safe day.